Rising time is 8:44. With the cold and flu season comes the increased risk for ear infections for not only kids, but we're also talking about adults here. And to talk about some of the symptoms of ear infections and how to treat it, Dr. Richard Gillespie of Queen City Ear, Nose, and Throat. Good morning to you.
Good morning, Dick.
Well, let's talk about, I'm sure there's various types of ear infections. So what do we typically see?
Typically, there are outer ear infections, there are middle ear infections, and then there are inner ear infections. When we're talking cold and flu seasons, typically going to see middle ear infections with a smaller percentage of patients with inner ear infections.
And so if it's in the middle ear, what kind of symptoms, what kind of things are we talking about?
Usually with children and even adults, you're going to have pain, especially when lying down. Sometimes you'll have hearing loss, dizziness, drainage from the ear. These are your typical symptoms.
Now, I know you brought a diagram here to kind of show the different areas of the ear. So obviously I see pointed out here is that middle ear area that we were just talking about.
This would be the middle ear area. An outer ear infections here. This is typically for swimmer's ear.
Okay.
We see those in the summertime. And then an inner ear infection occurs when there's infection within the cochlea itself, the hearing and balance organ.
Now, is that something where it moves from the middle to the inner, if maybe there's no treatment?
It can. You can have infection extend from the middle ear into the cochlea, or typically you can have a viral infection, a cold upper respiratory infection that extends into the cochlea directly. And those patients will have vertigo, hearing loss, and pain as well.
Now, if someone is hearing some of these things and they're thinking, okay, that might be me, or maybe someone in my family, what should someone do?
First, I would say see your primary care physician, pediatrician, internal medicine, family medicine. If it's obviously on a night or weekend, urgent care, emergency room. If you have a history of this, you can call our office, Queen City Ear, Nose, and Throat, and we'll get you in. What
kind of treatment options are there? And I'm sure it varies quite a bit based on the different types of ear conditions you've shown us.
Well, for middle ear infections, the treatment's usually going to be antibiotics. There is a movement, especially in Europe, to not treat middle ear infections and let them run their course.
Okay.
Typically in the U.S., we treat with antibiotics. If there's ear drainage or something like that, you may have antibiotic ear drops. If there are inner ear infections, steroids, antiviral medications are typically your treatments.
Are there any long-term effects of having an ear infection? I know we talked about the fact that middle ear, there's some belief to just let it kind of play out, but what can we see if this goes untreated for a long period of time?
Untreated middle ear infections can lead to hearing loss, a condition known as cholesteatomas, which is a destructive growth within the middle ear. Vertigo, especially inner ear infections, can lead to some extended periods of vertigo or dizziness. And so these things need to be addressed sooner than later.
Well, and Queen City Ear, Nose, and Throat, a growing practice. How do folks get a hold of you?
Well, we have our number, 704-703-1080. Our website, queencity-ent.com.
Okay, and we'll put that at WCCBcharlotte.com.
Absolutely, thank you.
You know, it goes quick and some folks might get confused typing that in. Dr. Gillespie, appreciate the time this morning. Thanks for joining us here.
Thanks for having us.
8:48 now. Let's go to Wilson one more time with CMPD Animal Care and Control and the pups. Hey, man.